what you should consider if your thyroid results are normal but you still don't feel well. And we are going to separate actual evidence from what you may have seen on social media. Let's start with something that confuses a lot of people, the laboratory reference range. When you receive your blood test results, you'll usually see a range next to your TSH or free T4. For example, you might see a TSH reference range somewhere around the lower end of normal up to roughly 4 or 5. But here's the important part. A reference range is not a magical line between healthy and unhealthy. Reference intervals are generally established using results from a reference population considered appropriate for that test. For thyroid tests, the American Thyroid Association explains that the normal range is generally based on the middle 95% of results from a healthy population without known thyroid disease. So the exact range can vary depending on the laboratory, the testing method, and the population being studied. But there's also a huge misconception we need to clear up. You may have heard someone say, if your TSH is about 2.5, your thyroid is already underactive. That's not a universal medical rule. A TSH of 3 or 4 does not automatically mean that you have a hypothyroidism. Thyroid function has to be interpreted in context, usually together with free T4 when TSH is abnormal, as well as your symptoms, medical history, medication, age, pregnancy status, and other clinical factors. So please don't diagnose yourself based on one number. Part 2. What does TSH actually tell us? Let's make this really simple. Think of your thyroid as a heater and think of TSH as a part of the thermostat system telling the thyroid how hard it needs to work. Your pituitary gland produces TSH. When the body needs more thyroid hormone, TSH can rise and stimulate the thyroid to produce more hormone. The thyroid mainly produces T4. T4 can then be converted into T3 in different tissues throughout the body. This is why TSH is such an important test. In fact, the American Thyroid Association recommends starting thyroid function testing with TSH in most situations. If TSH is high, free T4 can help determine whether the person has overt hypothyroidism or a milder biochemical pattern. For example, high TSH plus low free T4 is the classic biochemical pattern of primary hypothyroidism, but high TSH plus normal free T4 can fit a pattern called subclinical hypothyroidism, and this is where things become more complicated. Subclinical hypothyroidism doesn't automatically mean that every person needs medication. Management depends on factors such as the TSH level, age, symptoms, thyroid antibodies, pregnancy or plans for pregnancy, and other clinical circumstances. So again, one number does not tell the whole story. Do you really need a full thyroid panel? This is where social media has created a lot of confusion. You may see videos saying if your doctor only ordered TSH, they missed half the problem, or you need TSH, free T4, free T3, reverse T3, and every thyroid antibody. But that's not how evidence-based thyroid test works. For many people, TSH is the appropriate first test. If TSH is abnormal, free T4 is often the next important test. You don't automatically need every thyroid test available. The goal isn't to order more tests. The goal is to order the right test for the right clinical question. Let's talk about free T3 because this test is often misunderstood. You may have heard your TSH is normal, but you could still have low free T3 and therefore have hypothyroidism. But free T3 is not routinely needed to diagnose hypothyroidism. In fact, the American Thyroid Association notes that T3 testing is rarely helpful in hypothyroid patients because T3 is usually the last thyroid hormone measurement to become abnormal. Someone can have a significant hypothyroidism with a high TSH and low free T4 while their T3 remains normal, and free T3 measurements themselves can also be less reliable depending on the assay. So free T3 isn't a secret test that doctors are routinely forgetting. It has its place, but it's not the standard test for diagnosing hypothyroidism. And what about reverse T3? Now let's talk about one of the most popular thyroid tests on social media, reverse T3. You may have heard the reverse T3 is the metabolic brake. You may have heard that stress causes your body to produce reverse T3 and that this means your metabolism has essentially shut down. It sounds very specific. Here is the important distinction. A biological mechanism is not automatically a useful clinical diagnostic test. Reverse T3 is a real thyroid-related metabolite, but according to the American Thyroid Association, measuring reverse T3 is healthy. Non-hospitalized people does not help determine whether hypothyroidism is present and is not clinically useful for routine diagnosis. So if you have fatigue and difficulty losing weight, I would not tell you go get a reverse T3 test. That's the missing piece. That's not evidence-based thyroid care. What about thyroid antibodies? Now we are getting into something that can actually be very useful in the right situation. You may have heard of TPO antibodies, thyroglobulin antibodies, or TGAB. These antibodies can provide information about thyroid autoimmunity, for example, Hashimoto's hypothyroidism. TPO antibodies can also be clinically relevant when someone has subclinical hypothyroidism because positive antibodies are associated with a higher risk of progressing to overt hypothyroidism. But here's another important point. A positive thyroid antibody test does not automatically mean every symptom you have is caused by Hashimoto's. The result still needs to be interpreted in the context of thyroid function tests and the clinical picture. And antibodies are not necessarily something that every person with fatigue needs to test immediately. Again, the right test depends on the clinical question. Part 7. So what if your thyroid tests are normal? This may actually be the most important part of this video. Let's say your TSH is normal, your free T4 is normal, but you are still tired, losing hair, struggling with your weight, having trouble concentrating, feeling like your energy has disappeared. Does that mean your thyroid must have a hidden problem that the blood test didn't detect? Not necessarily. And this is where I want you to be careful with information you see online. Symptoms like fatigue, hair loss, difficulty concentrating, and changes in body weight are not specific to thyroid disease. They can have many different causes. For example, iron deficiency or anemia, insufficient sleep, chronic stress, inadequate calorie or protein intake, highly restrictive diet, certain medications, mood disorders, other endocrine or metabolic conditions, and many other medical or lifestyle factors. So if your thyroid tests are normal, but you still have symptoms, the next step isn't necessarily to keep ordering more and more thyroid tests. Sometimes the better question is, if my thyroid isn't the explanation, what else could be causing these symptoms? That's a much more useful way to approach the problem. What about hair loss and ferritin? Hair loss is another area where thyroid disease gets blamed for almost everything, but hair loss has many possible causes. Depending on the individual situation, your healthcare provider may consider evaluating things such as a complete blood count and iron status, including ferritin. But please be careful with another claim you may have seen online. Your ferritin must be about 70. There is no universal number of 70 that every person needs in order for thyroid hormones to work properly. That's not how thyroid physiology or iron assessment works. Ferritin needs to be interpreted in context, including your blood count, symptoms, iron status, inflammation, and overall clinical picture. So don't chase a magic number from social media. Now let's talk about one of the biggest concerns. Maybe my thyroid is the reason I can't lose weight. Hypothyroidism can absolutely affect body weight and energy expenditure, but it doesn't mean that every weight loss plateau is caused by the thyroid. And if your TSH and free T4 are normal, you should not automatically assume you have something called cellular hypothyroidism. You may see this term online, but it is not a standard clinical diagnosis that replaces conventional thyroid function testing. Instead, we should look at the whole picture: your calorie intake, protein intake, fiber intake, physical activity, resistance training, sleep, stress, and medications, changes in body composition, and how your weight has actually changed over time, because body weight is influenced by multiple biological and behavioral factors. It's not controlled by only one hormone. Part 10. So what should you actually do? If you're experiencing symptoms that make you concerned about your thyroid, here's the evidence-based approach. Talk to your healthcare provider about whether TSH testing is appropriate. Second, if TSH is abnormal, free T4 can help determine what is happening with thyroid function. Third, if there is a clinical reason to suspect autoimmune thyroid disease, your healthcare provider may consider thyroid antibody testing, particularly TPO antibodies. Fourth, if your thyroid tests are normal but your symptoms continue, don't automatically assume that you have a hidden thyroid disorder. Instead, discuss whether other causes should be evaluated. And there's one more thing I really want you to know. Tell your doctor if you're taking biotin. Biotin is found in many hair, skin, and nail supplements, and high doses can interfere with some laboratory thyroid tests, potentially making results look abnormal when your actual thyroid hormone levels are not abnormal. The American Thyroid Association advises avoiding biotin for 2 days before thyroid blood testing to reduce this interference. The big takeaway. So if you remember only one thing from this video, remember this: normal thyroid tests do not mean your symptoms are imaginary, but your symptoms also don't automatically mean you have a hidden thyroid disorder. TSH is an important first-line test. Free T4 is important when evaluating abnormal thyroid function. Thyroid antibodies can be useful in the right clinical context. Free T3 is not routinely necessary for diagnosing hypothyroidism, and reverse T3 is not a routine test for diagnosing hypothyroidism in healthy, non-hospitalized people. So instead of searching for a secret thyroid test, let's focus on something much more useful: finding the actual cause of your symptoms, because your body deserves an explanation, not just a label. And if your thyroid tests are normal, that doesn't mean it's all in your head. It means let's keep looking. Now I want to hear from you. Have you ever had normal thyroid tests but still felt exhausted, experienced hair loss, brain fog, or struggled with your weight? Tell me in the comments below. Please don't forget to subscribe.